Welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And today I'm excited to have Dr. Christina Gasbarro with us.
Thanks for having me.
Welcome, Dr. Gasbarro. Dr. Gasbarro is a family care physician and she's over at a brand new practice. Do you want to tell the folks where you are?
I am. So we are located in Assembly Square. One of the best landmarks or easiest landmarks is the Home Depot. But our building is lovely and new and has a giant CHA sign, so should be pretty easy to find. It's 5 Middlesex Avenue is technically the address.
5 Middlesex Ave? Good. Home Depot's a big landmark over there. Right. Can't miss it. So today we're going to talk about diabetes. Now, diabetes is pretty prevalent.
It is. There are about 20 million Americans that have diabetes.
So where does it come from?
Oh, that's a good question. So it's multifactorial. So that means that there are a lot of different things that really influence when someone gets diabetes. Some of it's genetic, so you can thank your parents for that. Some of it is diet and lifestyle. So those are the things that we really try to work on to help prevent or make diabetes better.
Do you think a lot of it is diet and lifestyle?
A lot of it is.
A lot of it is, yeah.
But, genetics do play a role.
So, but that could be a good thing.
Yes.
Because that's something that we have control over.
Absolutely.
Right?
Absolutely.
The genetics, we don't have any control
Correct.
over. So diet and lifestyle, at least we can give it our best.
Yeah.
So what would that look like, our best?
Well, can I explain a little bit of what diabetes is to kind of...
Absolutely.
Sure. Perfect. So diabetes is the failure of your body to make the appropriate amount of insulin. So insulin is made from the pancreas, which is an organ that's located right about there, and it helps move the sugar that you have in your body. So whenever you eat, that sugar is absorbed, moves to your bloodstream, and the insulin helps move it from the bloodstream to everywhere it needs to be. So your muscles, which need sugar to work,
all kinds of sugar? Or like natural sugar?
So it
doesn't matter?
The sugar or food that gets broken down into sugar.
So that could be carbohydrates.
Yes, exactly. So it moves it to the muscles, the organs that need it, so your gut. So every place in your body that needs sugar to function needs that insulin to help move it to the right place. So when people have diabetes, or the sugar as some people call it, they have way too much sugar in their bloodstream and not where it needs to be. So that can lead people to have symptoms of feeling pretty crummy, pretty tired. They pee a lot because all that sugar is going into their urine instead of where it needs to be. So it's not a very fun disease.
Right.
But
and it could thirsty sometimes too?
Yeah, so people can feel very, very thirsty. Part of it is because they're peeing out all the fluids that they're getting in.
Right.
And it really just dries out their mouth, so they keep trying to drink a lot of water. So that's one of the really kind of red flags that we look for when people come in complaining of things.
Right. And lethargy, if they're lethargic and can't stay awake.
Correct.
I've witnessed that.
Yeah, people can be pretty tired, and sometimes they've got belly pain with all these things combined, and they just don't know what's going on. And one of the first things we do is check their sugar.
Check the sugar.
Yeah.
So, then typically, I guess it depends. When you check the sugar, is it a blood? It's a blood test.
Yeah. So there are a few different ways that we diagnose diabetes. And one of the classic ways was having someone come in fasting, so not having had anything to eat for at least 8 hours, and checking their finger stick, so checking a little prick and seeing what the sugar is at that time. And
what is the normal range?
Yeah, so anything over 125, so 126 and up, concerns us for diabetes if they're fasting.
For the fasting.
For the fasting.
Okay.
Another way that we generally don't do, because it's not a very fun thing to do, is have people drink this very sugary drink, and then we check their sugar 2 hours later. And if it's over 200, then they're considered diabetic.
So what is the sugary drink? Is it like hummingbird nectar?
It can kind of taste like that. It's just a very highly concentrated sugary beverage that has a specific number of grams, and we know how much your sugar should be, which should be below 200 after 2 hours. But
I think I'd rather do the fasting.
Yeah, so we try not to torture people and have them hang around the office for 2 hours if they don't need to.
Right.
And then one of the other things we do is sometimes a random sugar, so checking them anytime if they come into the office, if they're feeling crummy especially, and their sugar is over 200, at that point we have a pretty high suspicion that they're diabetic.
Really, whether they've had lunch or didn't have a meal or
Correct.
whatever.
But especially if they're complaining of the things we talked about. So dry mouth, peeing a lot, those are, with that and the sugar being high, is really indicates that they have diabetes.
So then, so if you find that someone is in that range, then do you try diet first? I mean, how do you know where they are, on the scale? Whether they need an oral medication like metformin is one that I know,
right.
And glucophage. I don't know if they still use that, and or try diet first, or do you go slow? Or how do we do it?
Yeah. So one of the more recently approved ways to diagnose diabetes is something called the hemoglobin A1C, or
the A1C.
Yes.
We hear about that on TV now.
Yep, or glycosylated hemoglobin. And that's another way to diagnose it, but another way that we like to monitor people's diabetes. So
that's a blood test?
It is a blood test, so it's a
blood test.
A big blood test.
A
big blood test. And science is fascinating. So they figured out how long red blood cells live in your body, and hemoglobin is a part of the red blood cell, and the sugar attaches to that. So the scientists have figured out that we can kind of guess an average of what people's sugars are over a 3-month period by using this test.
So you do the test every 3 months?
Generally, if people are not well controlled, we like to check every 3 months. If they're doing pretty well, then every 6 months.
And then by the numbers that come up, you know that whether they're diabetic or not,
Exactly.
or whether they're within range.
Yeah, exactly. So anything 6.5 or higher is considered diabetic.
6.5. So the normal range would be?
So 5.7 to 6.4 is pre-diabetic, so someone's at higher risk of becoming diabetic.
Okay, so you want it below
under
the 5.
that, and that gives us an idea as to how bad someone's diabetes is. So if someone is over 10, that's a pretty scary high number, then their sugars are generally running in the high 200s, 300s on average. And that pushes us to start someone maybe on insulin right away. But it really depends on the patient, how motivated someone is to diet and exercise and really change their lifestyle, and how much support they have, because insulin isn't an easy thing, and we try to avoid it if we can, but those sugars that are really high are pretty scary and can end up with having people in the hospital.
Right. I know my mother was diabetic, and when her sugar was, she could function when her sugar was high. When her sugar went low, she couldn't find, that was more dangerous.
Right.
She could not, even move.
Right. So in our mature population, so people over 60,
I like that.
people over 65, we tend to be a little more relaxed about how strict to be with the A1C. So younger people, we tend to want a goal of a hemoglobin A1C less than 7. So that's generally sugars less than 180 on average.
That's still high.
That's still high, but 140 to 180 is what
The ideal sugar count would be 120 or less?
Well, for a diabetic, really 140s.
But if you're not diabetic?
If you're not diabetic, so remember I was talking about the fasting 125?
Yeah.
So that's kind of what we would want.
So under
that.
Okay.
Okay. But for, like I said, the more mature population, we tend to aim for 7.5 or less than 8, because we worry about those really low sugars. And the hemoglobin A1C is a fabulous test, but it gives us an average. So it doesn't really tell us what the low is or what the really high is.
Oh.
So someone could be running, in the 180s the whole day, and we're, at least there are no lows, no super highs. But someone could be averaging 180 and having something scary like 70s or 60s, and then having 300s or 400s. So we always have to be very careful.
And that jumping, that's dangerous.
Right.
Yeah.
So we generally want diabetics that are on insulin to check their finger sticks, to check their sugars at home throughout the day.
Right.
And if they're not on insulin, then it depends on the conversation you have with your doctor. So sometimes when we're starting a medication and we want to be extra careful, we ask people to check their sugars a little bit throughout the day. We don't want people to go
crazy.
with it, because it's also, it's a risk of infection. You're poking yourself. It's a small poke, but still.
So like 3 times a day?
So it really depends. So if someone's on insulin, 3 to 4 times a day. If someone's not, sometimes the doctor may want you to check a few times a day for a week and then stop. But really, if someone is feeling symptoms of low blood sugar, so headache, dizziness, racing heart, and if you have your glucometer, then at that point I would say that's a good time to check it. But there are a lot.
And then what?
And then what? Then you usually have a little orange juice, little candy in your pocket. And your doctor would definitely recommend that if you're someone who tends to run low on occasion.
I've even heard of a sugar cube. Is that too much?
That may be too much, but they do have little sugar pills that we can prescribe. But the most important thing is making sure people are eating throughout the day. I know a lot of diabetics who end up saying, "Oh, I don't eat much, doc. I have 1 meal a day."
Not good.
Not good whatsoever.
It's really not good for anyone.
No, absolutely. So we want to make sure they're having at least 3 meals a day. Sometimes your doctor may say have a snack before bed, especially if the sugar is a little bit lower in the morning. But being smart about what you're eating is the important thing.
Right. Fruits and vegetables.
Yeah, so exactly. So fruits and vegetables are really wonderful. Fruits do have some sugar, natural sugar in it. It's better than the sodas that are out there and the candy bars. So the natural sugars are better, but making sure that you're avoiding
But you still have to pay attention to them.
Yes, making sure you're looking at the labels. So things that have carbohydrates, that it doesn't have too much or a lot in there. If you have 2 options and one has higher carbohydrates and one is lower, pick the lower one. And then being smart. So people forget that rice and pasta also break down into sugar. So try to go for the whole grains and the whole wheats. Those tend to be better.
What about oatmeal, the oats? Does that break down? It's still carbohydrates.
It does. Yeah. But oatmeal can be good and can fill people up for longer periods of time. So that can also be good. But just making sure that you're going for the lower carb option if they're, when you're at the grocery store and picking between 2 different brands.
And I've always heard that if you're looking, say, at a salad dressing, and the higher up, in other words, if sugar appears in the first 5 ingredients, you've got a lot of sugar. Yeah. A lot more than if it appears at the end of the label.
That's true. That's generally true, but they can be a little sneaky with their labels. So always try to compare, or even make your own dressing.
Right.
It's always a smart thing to do.
Right.
We have CHA has wonderful registered dietitians that have been trained in coming up with meal plans for people, and they're wonderful substitute ideas. Like we have a lot of patients that like to make their own tortillas, and using flaxseed instead of flour can be really helpful and a really healthy substitute. But they have wonderful ideas and have, if people have issues or problems coming up with meal plans, that's one option.
Making your food really gives you more control over what you eat. Right?
Absolutely.
And I know it's difficult when you travel, or if you're not at home for any reason, when you go out to dinner, then I know it's difficult to pick and choose, but really it's all about the choices we make as to what we have. But I think, as I've experienced, that education is key.
Yes.
Education, learning. Like we're talking about these carbs, but there are complex carbs and there are simple carbs. And fruit is a simple carb. The simple carbs are better to eat than the complex carbs. The complex would be in pastries.
Yeah, that's a very good example.
I go from one end of the spectrum to the other. But just to give people an idea of, not that we don't know what we should be doing.
Yes. So the easier things to avoid, obviously, are the red flags. So the pastries and the candies and the juices. But, choosing like kidney beans and chickpeas as part of your meal, substituting that in for something else is also a great option.
So they're still carbs, they're still starches, and they will convert.
But they tend to be lower than other things, and making sure you're trying to avoid those white breads, because those tend to be
the white stuff. I always tell people the white switch.
Yes.
You know, not the white stuff. Switch to the brown rice and the sweet potato instead of the white potato, and the whole grain breads.
Right. And I tell patients, it's a lifestyle change. You don't need to go too crazy right away because you're going to get tired and then you're going to want to cheat.
Right.
So, if you're having your rice and potatoes for dinner, pick one. Switch the other one out.
Right. Right. So it is a tricky disease, and it's I call it the great remover because it can affect if we don't take care of it, right? And it runs rampant, and the sugar runs higher. Oh, so I'm just thinking as we're talking, I know things like stress. Stress also pumps up blood sugar. Is that correct?
Yeah.
So anytime we're under any stress, the sugar goes higher. So we want to de-stress our lives. And as far as organs that it affects,
Yeah.
diabetes.
But diabetes pretty much affects your whole body, so from head to toe. So your eyes, so definitely getting that annual eye exam if you're a diabetic is very important. Diabetes can cause something called retinopathy, which can lead to vision loss. So making sure the sugars are well controlled is important, and making sure the eye doctor takes a good look to see if you're developing that. There are drops and certain procedures that they can do to help prevent it from getting worse.
So what is that? That's not a detached retina.
No. So diabetes affects the smallest blood vessels in our body as well. So you have blood vessels in your eyes. So it really is just diabetes affecting the blood vessels.
So the blood doesn't flow as through?
That's a way to think about it. And like I said, there are laser procedures that sometimes the eye doctors end up doing to help out with that and help prevent vision loss.
Right.
Because that's our goal. We want to make sure that all of you guys are still able to see.
Right.
And diabetics are actually, I think, twice as likely to develop cataracts and glaucoma as well. So making sure that the eye doctor is checking that out too.
Right. So there are several diseases of the eye that diabetics are prone to.
Exactly. I forgot about the head. So stroke. So making sure that your sugars are well controlled helps lower your risk of stroke, because diabetes increases the risk of stroke.
Really?
And so no one wants.
So how does it Because stroke is blood going to the
But still blood vessels.
I figured that out by myself.
Yeah. And then heart attack. It also can increase your risk of heart attack.
So it puts you at risk for
Right.
all the.
And it can affect your gut. So a lot of diabetics have issues going to the bathroom and having bowel movements, because it slows down how your gut's functioning.
So it would be more constipation.
Which is not fun for anyone.
Right.
So making sure, like I said, your sugars are under control can help prevent that.
It really affects everything.
Yeah, and then down to your toes. So making sure that you're checking your feet every single day. If you shower in the morning or brush your teeth in the morning, making sure that you're just peeking down at the bottom of the soles of your feet. Diabetics tend to lose sensation over time.
Oh, that neuropathy. Yeah.
And it can not only lose sensation, sometimes diabetics can have pain from that.
Right. I thought neuropathy was loss of feeling. But I had someone this morning tell me that she was in extreme pain with neuropathy.
Right. It's a different type of pain. It's not the type of pain where, if I hit my hand on something, it's they describe it as like a burning pain, sometimes tingling, sometimes of a numbness. It's really uncomfortable for some patients, and it's really hard. But one of the best things to do is, if your sugars are out of control, get them under control. Because I've had plenty of patients who come back with their A1C nice and within the range that it should be, and they notice a big difference.
Really?
It's not all completely reversible, so sometimes some of the damage is already done. But definitely, it definitely helps getting the numbers better.
That burning and tingling, that sensation, it affects the nerves? Is it the nerves it affects? And is it the blood going to the nerves, or what is it? How are the nerves affected?
So it affects the longest nerves in your body first. So if you want to think about the nerves from the spine have to go all the way down to your feet.
Like the sciatic?
So, that
We
is
know
a
what
nerve.
that's like.
Yeah. But it affects that, and then once you get to your knees, it tends to affect the hands too. So sometimes people have uncomfortable hand feelings. Not quite sure if it's really the blood flow, because blood flow is also something that it can affect. Diabetics tend to also be at a little bit higher risk of peripheral artery disease, so blood flow issues to the feet too. So we think it's two separate mechanisms, but it does affect the nerves.
Wow.
And healing is also a big thing.
And what?
Healing.
Oh, right, wounds. If you get a cut or, right.
Yeah.
So, especially in the older adults. Yeah. So, why is that? Why don't diabetics heal well?
Yeah, so it all comes back down to the sugar. So a few different things. So diabetics are at higher risk for infection because sugar is delicious to little bugs, right? So if you think of any bacteria, it's living in a happy, sugary environment.
I never thought of it that
right?
way.
So that's how I like to think of it.
Well, that's a good way to think of it because it gives people a visual.
Yes. So it puts them at higher risk of infection. If something's infected, it may not heal as well. And then just getting all the good nutrients to those areas, the body doesn't like to close, if that wound's open, doesn't like to close as well. It takes a little bit longer. And some diabetics suffer from wounds that don't close ever.
Right. And then they have to go through the wound care and that whole process.
And sometimes getting surgeons involved, and it's at a higher risk there, so it can get really complicated.
Right. So there is a very good reason to pay attention to your body when you have the disease of diabetes, and it does it ever go away?
Well, some people can do a really good job managing their diabetes to the point where their numbers are almost normal, right? I'm not to say that I don't have a few patients who really lose the weight, exercise really hard, eat the right things, and are not on any medications, and are no longer in the diabetic A1C range. And so we pretty much say they don't have diabetes at that point. But unfortunately, those are few and far between. Not to say that it's impossible, just you need a lot of dedication for that.
Dedication, right. And education,
Yes.
right? Paying
Yes.
attention to all the things that we're talking about now.
Yep.
Yeah. So as far as exercise?
Yeah.
Now, for the older population, sometimes mobility is affected.
Yeah.
And it's more difficult for them to exercise. I try to tell them to move however you can, because moving anyway is better than not moving at all.
Exactly.
Right? So is there any other kind of exercise that they might be able to do, even if they're sitting there saying, I can't do that, I can't jog, I can't walk, I can't whatever?
Yeah. So I'm not expecting everyone to be running marathons by any means. If you are capable of walking, making sure that you're walking at a pace where you really can't talk to your neighbor. That's one way to make sure that you're kind of exerting yourself, and that's the most kind of bang for your buck, the most beneficial thing that you can do. And if you're not really mobile otherwise, if it's hard because you have back pain or issues, making sure that you're doing some leg, strengthening exercises. You can get some free weights that are pretty, like 1 pound weights. You don't need to go too crazy, and at least trying to get that upper body moving a little bit can be helpful. And then sometimes, depending on what ails you and your conversation with your doctor, sometimes getting people into physical therapy can be helpful too.
This morning I was pounding the drum of water aerobics.
Yes,
Yeah.
that is a wonderful option too. Making sure that you're not putting too much stress on those joints, especially if people have pretty bad arthritis. That's a wonderful way to do it too.
Right. So let's see, what else do we have to cover as far as diabetes? There's so much, and sometimes we don't know what we don't know. Right. So we don't know what questions to ask if we haven't had any experience with certain things. So let's talk about so as you mentioned before, that we could have, if your numbers aren't too bad, then you can manage it with diet and exercise. If you are just over that, then maybe you would need an oral medication.
Yeah. So one of the first medications that we tend to offer patients is something called metformin or glucophage.
Is it the same thing? Oh, it is? I didn't know that.
It is.
Metformin is a generic name?
Metformin's a brand name.
I never knew that.
And that medication works in a number of different ways. It helps prevent your body from breaking down things to create more sugar. It helps your body, your pancreas, somewhat release its natural insulin. And then there's this anti-inflammatory property we don't completely understand as well that can be helpful. So it's a great medication. It's actually been shown to decrease cardiovascular risk, so risk of heart attack and stroke.
That's a good thing.
So those are two wonderful things, which is why we try to put patients on it no matter what.
There are a lot of people on it.
Yes.
Yeah.
It can lower your A1C about a point, sometimes a point and a half, it just depends. And one of the side effects that people tend to get when they start their medication is a little GI upset.
Yeah.
But if you start at a low dose and bear with us, and in about a week those symptoms tend to resolve, and sometimes they come back when we increase your dose, but once again they tend to resolve.
So be patient.
So just
and
be
work through
patient.
it.
Yes, exactly. One of the other side effects that we, I think that's actually pretty much the one that most of my patients complain about. If they can bear with me with that, that's definitely what I do.
Okay. And then if they're higher than that, then it would be insulin.
No, potentially
No.
potentially other oral medications. There are a lot of different ones that have come out.
Oh.
Some of them put you at a little bit of higher risk of those low sugars.
Oh,
So we
right.
always try to be a little bit careful and make sure that the patients that we put on that are actually eating 3 meals a day, aren't skipping meals. But things like glipizide is another one.
Oh, yes. Yeah.
Falls into what we call sulfonylurea family. That also helps lower the sugars. And then there are a bunch of different ones. They're actually one of the more recent medications that we were trying to kind of push for a little bit are the GLP-1 medications. It's unfortunately a shot, but depending on your insurance, sometimes it's a shot once a week, sometimes it's once a day. But that has actually also been shown to decrease your risk of heart attack and stroke.
So what determines once a week or once a day? The severity of your sugar?
No, unfortunately, it tends to be what your insurance covers.
Oh. So either way is helpful? It would be...
There's been a little bit more research on the once a day medication, but there's still research being done right now that they think that both of them actually may be
So then you would
beneficial.
hopefully be able to self-inject.
Mm-hmm.
Right. It's like insulin. And then there's insulin?
And then there's insulin. We try to take people off of all those oral medications that put them at risk of low blood sugars if they're going to be on insulin, and tend to keep them metformin going.
Oh. But that lowers sugar as well.
It does, but it doesn't put you at risk of those low sugars like the other medications.
I see. So in insulin in your body, well, I think we're...
Yeah.
Yeah, we are there. This certainly has been a very informative show, and hope you've learned a lot. I certainly have learned a lot, which is why we keep doing the show.
Yeah.
So thank you very much.
Of course.
And maybe we'll bring you back again sometime.
Thanks for having me.
Thanks so much.